Here in the Den, young kinesiology students get a once-in-a-lifetime chance to pitch their ideas to 5 of Canada's fiercest OHIP policymakers, the kind of people who can make or break healthcare treatment.
Hello Dragons, my name is Nikki, this is Sam, and this is Tally. We are 3 kinesiology students from the University of Waterloo looking for your help.
We want omega-3 fatty acids to be prescribed by doctors and covered by OHIPs for joint pain management with people with rheumatoid arthritis. We have done our research and we are going to tell you why. This treatment can be used to decrease pain for both men and women over the age of 40 living with rheumatoid arthritis.
Dragons, I want you to think about what it would be like to live with constant pain in almost everything you do. I don't mean heavy, strenuous labor, but simple things, like carrying your groceries, walking upstairs, or getting out of bed. This is what it's like to be living with rheumatoid arthritis.
Rheumatoid arthritis is an autoimmune disorder classified by chronic inflammation affecting the synovial membrane of 5 or more joints. Patients are experiencing painful swelling, which results in bone erosion and joint deformity. Rheumatoid arthritis can also affect other tissues such as the heart, lung, and eyes.
How big of an impact does this disease have in Canada, and why is it such a big issue?
In 2010, there was about 1% of the Canadian population living with rheumatoid arthritis. This represents 272,000 Canadians living with this disease. This number is expected to double to 550,000 by the year 2040. This will have a huge impact, especially with an expected cost of $300 per month per patient to the healthcare system. That currently costs the healthcare system $1 billion, which is expected to double by the year 2040.
There is no current treatment for rheumatoid arthritis, but doctors often prescribe non-steroidal anti-inflammatory drugs, known as NSAIDs, such as ibuprofen and naproxen to help reduce inflammation and manage pain. NSAIDs are used as a main treatment for rheumatoid arthritis and resulted in many serious side effects. However, by implementing omega-3 fatty acids, these side effects can be significantly reduced. Not to mention it will be cheaper for the patient as well.
How much cheaper?
The cost of NSAIDs usually range between $50 to $300 for the average rheumatoid arthritis patient. But here are a few examples of the cost of individual NSAIDs. Ibuprofen can cost approximately $20 per month. Naproxen can cost $270 per month. A stronger NSAID commonly used is methanic acid, which can cost up to $1,548 per month. A 1-month bottle supply of omega-3, which can be bought at Walmart, only costs $22.50.
Although NSAIDs have been used for a long time as a pain management option, there are many serious side effects that are associated with these drugs that can lead to more costly problems.
Continued NSAID use often leads to fluid retention. This then leads to edema and various gastrointestinal problems, such as nausea, diarrhea, constipation, and decreased appetite. Often more serious side effects include risk of kidney and liver failure, ulcers, heart attacks, and stroke.
Is there a very high incidence of these side effects?
Yes, the research shows that over a third of patients will experience some or all of these side effects. For example, dyspeptic symptoms are estimated to occur in 10 to 60% of NSAID users. This has led to a discontinuation of NSAID treatment in 5 to 15% of rheumatoid arthritis patients. Unfortunately, studies have shown that over half of these conditions were preventable.
Side effects cost the healthcare system an extra $1 a day for every patient who is on NSAIDs. Of the 4 million prescriptions written in Canada for arthritis, 360,000 were for rheumatoid arthritis alone. We need a better way to reduce pain which doesn't result in unnecessary side effects and costs to the healthcare system. Omega-3s can reduce the burden of the healthcare system by 42% and increase the patient's quality of life.
This is why we've decided to ask for your help. We reviewed the research and come to the conclusion that giving patients with rheumatoid arthritis a dose of 2.7 grams per day of omega-3 fatty acid in supplement form, as long as the supplement contains EPA, DHA, or both, will reduce the amount of NSAIDs used. The literature considers a decreased use of NSAIDs as a measure of pain reduction.
So, if you give people with rheumatoid arthritis this pill, will their pain go away instantly?
That would be ideal, however it is unlikely. Patients would be reducing their intake of NSAIDs on a self-regulated basis as their pain decreases. Studies show that taking 2.7 grams per day resulted in a reduction of NSAID usage continually over the course of a year and then leveled off after 15 months.
Should they cut out NSAIDs altogether? Is it safe to go off NSAIDs and just use omega-3?
At this point, it's not sufficient to use just omega-3s. The University of Maryland Medical Center stated that omega-3 fatty acids can be used as a method of pain management as long as it's combined with traditional methods such as NSAIDs.
How will it reduce the human or economic burden of disease?
Omega-3 fatty acid consumption decreases NSAID consumption, which decreases the need for medical attention due to side effects from NSAIDs. This will help decrease the burden that rheumatoid arthritis patients have on the healthcare system.
So are there any negative side effects for using omega-3 fatty acids?
Nausea was a side effect that seemed to occur in 4% of trial groups in a study we found. However, a gradual build-up of the recommended dosage seems to eliminate this issue. We have not found any research showing any serious side effects for the dose we are recommending. This seems good. What do you think?
I like it. I'm in. Is anyone else going in with me?
I'm in.
I'm in. I'm in.
We're all in.
Thank you, Dragons.